So, as you know, the paper is Cultural Adaptations in Television Technology for Older Adults with Dementia in Care Settings. And the authors is Karen, and who is a PhD student in the School of Social Work at UBC, and Dr. Lillian Han. And I was just an intern working on this project at the same time, helping collect the data that you see in the project, and Lily helped us implement the cultural adaptation. So we're gonna just go through briefly what the presentation is going to be going through. There's 4 sections. It's gonna be a background really briefly on current research on cultural adaptations and technologies for dementia care, methods, and we're gonna discuss briefly the methods we used, discussions of cultural adaptation, process CAP, and the ecological validity model EVM. And then we're gonna talk about the results, which includes feedback from the sites and from the patient and family partner involved. And then we will conclude with the importance of cultural and adaptations and technologies for adults living with dementia, and the limitations of the study. So the background about the existing literature and how we arrived to culturally adapt our television program of use. So in current existing literature from the paper, as you can see, it defines cultural adaptation as adjusting an intervention to better suit person's language, cultural values, and norms. And the main idea is that a lot of times these patient education materials would not relate to the patient, and the patient wouldn't take to heart these patient education materials, which is so vital for health. So oftentimes it is really important to adjust the intervention to better relate to the target demographic that you're targeting, the patient that you're trying to give these materials to. Usually is what cultural adaptation was talked about in terms of the healthcare system. And the existing literature on this topic includes Parker et al. Investigating how to adapt interventions for typically English-speaking family caregivers of people living with dementia. So a little bit similar with our topic, specifically for Hispanic and Latino or Latino Spanish-speaking family caregivers living in the US. So I don't believe it was quite to do with technology. So there's a little bit of a gap is what we're trying to say here. And Sit et al. 2020 investigates how to adapt English digital mental health interventions for young adults who speak Cantonese or Mandarin. So basically, little to none literature exists specifically for cultural adaptations for technologies catered to those living with dementia. So specifically, technologies catered for clients living with dementia. So I did do a brief search within the CINO database, a database specifically, like not specifically, but catered to nursing research at least. And as you can see, oh, I blocked it out there, but when I try to include cultural adaptation or culturally adapted and television, TV, media, or technology, or smart TV, and dementia, or a lot of like synonyms that I was trying to use with the Boolean operators, I only had 2 results, and looking at this, it is the same paper. And it just came out in 2020. So when I ran this search a little bit earlier, actually, it came out with nothing. And I was going to present that screenshot with everybody. But then out came out 2 from recently. So I wanted to include that as well. I haven't read that paper yet though, actually, but it looks interesting. See what's in the chat. Oh, okay. Yes. Oh, and then just another search. When I took out one of the search terms to make it just with cultural adaptation and technology in general. And I, of course, got a lot more search results, around 135 in comparison to the 2 or previously 0 that I had. So originally when we started this project, this research project, it wasn't to investigate cultural adaptations. So we had a environment where a lot of the research sites that we wanted to work with, some people were saying that the videos that we were trying to test out, the videos catered for people living with dementia, we were trying to test out, was being ignored by the residents. So looking at Canada, Canada has a lot of immigrants, which is great. It is our strength. 21.9% of the Canadian population are immigrants. 17.7% of Canadians are second-generation immigrants. And I can imagine that number to be much higher where we are from, where Lillian and I are from, which is Vancouver. And oftentimes bilingual individuals living with dementia revert to single language use, which I do see happen commonly in my hospital rotations. I've also been working in long-term care homes since high school. It's really common where the children cannot speak the parents' languages, and because the parent has forgotten the second language, and it's really sad to see sometimes. Similarly, there was a patient who never spoke German past the age of 3, but now can only speak German. So it's funny how these things happen. Oh, yes. So since our videos sometimes wasn't being understood maybe by a lot of residents, sometimes residents see at the certain site where a lot of residents weren't speaking English, they would see like this big English word just covering the video, and sometimes they would just be tuned away because they would maybe realize that they can't understand the video, unfortunately. And we didn't realize this. We just kind of worked with a company and gave these videos to try out to see the effects of these videos. So then we realized, okay, well, we have to adapt these videos so that way the sites can actually use these videos so we can actually generate data. And of course, we should also think about why we are not being more inclusive of other people. So we asked the company to please translate the videos as appropriate for diverse populations and languages. So some of these translations helps with the cultural adaptation. Some methods to do this cultural adaptation include EVM, Ecological Validity Model, originally developed for Latino populations in the US as a guide to adapt existing interventions for a specific racial or ethnic group. So this guide is to just help ensure that you consider different dimensions when it comes to cultural adaptations, which in this case includes language, which is what we were trying to cover, persons, metaphors within the language, content, concepts, goals, methods, and context. But usually in what we see in the literature covering this EVM and CAP is that it lacks a client or patient focused approach where you specifically ask the client or the patient specifically their thoughts, their opinions, and your data collections. Yeah, a lot of these were aimed at caregivers, which is very important, or family, which is equally important. But they just kind of missed this one little aspect. In CAP, we also follow the 3 stages that cultural adaptation processes usually take, which is local consultations, you make focus groups, which is what was happening when the research sites gave us their feedback that the videos wasn't inclusive enough. So we worked with 2 research sites of diverse populations, and we just needed to respond to the needs and gaps. And after we made the videos with the thanks of Lily, Wang, the family partner, we went through iterative testing and adaptations, prioritizing ADL videos specifically when we made these adaptations, because that was what the sites voiced that they needed the most, and produced a video with their patient and family partner, Lily, to test it at the research site to observe that staff and patient response. So what I'm going to do is I'm going to just briefly share the videos. There's going to be 2 videos, and one is going to be before the adaptation, and then one is going to be after the adaptation that Lily made so kindly for the company, honestly. And then Lily is going to talk a little bit more about her experience making the videos as a family partner. So let me just briefly share the videos really quickly. 1 second. There it goes. Okay, so the original video for drinking water was to encourage, hopefully, those living with dementia to drink water on downtime, usually. So just wanted to skip ahead. So as you can see, of course, the video does start off with big English wording, which maybe for people who can't read English, they might be turned away from it. They might assume this is a video that they will not understand, that's not inclusive of them.
Hi, it's so nice to see you. Whew, I am so glad to have this water.
Just really briefly. So I actually really like that video. I do think it's very friendly. But this was, let's see, the video that we did a cultural adaptation. That Lily did a cultural adaptation. I did nothing for.
飲水會令你身體健康。我哋一齊嚟飲水。好好飲啊！
All right, sorry. I should have mentioned, I'm so sorry. So obviously in Vancouver, a large population is Cantonese speaking. So one of the research sites we worked with, a care home, they have a main population of Cantonese speaking elderly residents. So the cultural adaptation was for those who are Cantonese speaking. So did I stop sharing my screen? Yes. Okay. So yeah, Lily, do you want to talk about your experience and your feedback making the video, the cultural adaptation with Xenia TV?
Yeah, even though there's only a very short version in Chinese, but it took almost 3 hours to do this video. The one factor was we were next to the furnace room. When the furnace went on, we have to stop and redo everything. Original, when we did it, I believe we have both English and Chinese. But in the video, I didn't hear any together, like one sentence in English and then the same sentence in Chinese when we first did it. So I didn't see it in the video. I haven't really watched this video totally because I don't have access to the senior TV. So I just recollection from what I did. We did like, we have to repeatedly do it to make sure the sound was correct and the speed was okay so people can understand. The reason also when they ask me is because I'm older Chinese, like senior, so the resident will relate better. Because when they see me drinking, they automatically will take up the cup and drink. So instead of the staff standing in front of them and tell them, it's not very effective. And then it takes a lot of time of the staff. But when they look at the video, they just automatically pick up the cup and drink a little bit at a time. So apparently it's quite effective, I was told. And I don't know how many places they use it, but at least they use it at Villa Cathay, which is near Chinatown. And there's lots of residents Chinese speaking, especially Cantonese speaking. So they could relate much better. And and they don't have to be a staff standing in front of them to push them. Because older folks, they don't seem to realize they're thirsty. They kind of not wanting to drink a lot throughout the day, maybe inconvenience or something. So during COVID, it was very vital that they have to drink more. So that they came up with this idea of doing this video.
I do want to note that they took a lot of your energy, Lily, for 3 hours. So it's very great that they agreed to our suggestion to culturally adapt the videos. Yeah. But of course, it was a long time, right, Lily? Yeah. A lot of work from you, more than what we see.
Exactly.
Yeah. What was some different things that you mentioned doing about boiling? Was it boiling the water or doing the water from the tap? Was that different by any chance? Like the way the clips they used?
I think using a glass and from the tap, the resident will think that's just cold water. And most of the Chinese older folks, we drink warm water, not cold water. So that's why we use a cup. So that indicating that it's warm water in it. I didn't drink it, so I didn't really know it was warm or cold.
Yeah.
Yeah, I was just pretending to drink. Yeah, they could relate better that way. From the tap, it's always cold water to them. And most of the older immigrant, they don't drink cold water. Yeah, the young one maybe now they do. Yeah.
Yeah, I think it's really important as well for companies who want to make these cultural adaptations, which would be so appreciated, to really value the time of these family and patient partners, which are so vital for the healthcare system. So one critique of mine would just be to really think about that, because we also made German adaptations, and I was there as well, trying to coordinate that. And it was fun, but the poor German girl was tired by the end, and I remember going, this is going on too long. You're gonna have to wrap it up. Yeah, like really plan it well, because you don't want to be taking up these people's energies too much more than I feel like you should. Because I already felt so in depth to like Lily or the other the other people doing like really great work to make our interventions more inclusive when they should have been originally already. So I just felt horrible when she was tired. Yeah.
It was okay.
Okay, that's good. Yes, remember because I was working with some other people
Yeah.
as well. Yeah. So the video that Lily made, when I share my screen, I can't see people anymore. I don't know why. So it looks a bit weird for me, but let me go back to the presentation. Yeah. So the video that Lily made actually did make an impact. We did see people like drinking water more actively. So a lot of times, and Lily, feel free to jump in anytime as well. One of the researchers works at the long-term care home where this video was primarily used. This particular video that Lily made, we made other ones, but this particular one that Lily made as ADL as assisted daily living video to encourage residents to drink water. The residents were very much actively drinking water. So we did data collect that because normally you could put water in front of residents. And this study was targeted towards those living with moderate to severe dementia, where they wouldn't be drinking the water, and sometimes you can encourage it. And I also was in a long-term care home working there younger, and it's sometimes hard for me to convey my message that I want them to drink the water. I didn't know how to say it, but one of the researchers noted that they were very much actively drinking water, and I could also see that too. So it shows how important these cultural adaptations are to promoting the health and well-being of our targeted audience, which was for our study, those living with moderate to severe dementia. And we also noticed that not every video maybe needed cultural adaptations to be very much accepted in a primarily in a group where maybe the video wasn't targeted towards. We had videos about Ukrainian food specifically, and all the residents, the Chinese speaking residents, were very interested in it because they were like, oh, what's that food? Very interested in looking at the video actually. Food is very universal. Babies, everybody loves babies. Doesn't have to look like you or be your age, of course. And it was really important for these videos to be simple. I think, Lily, that's what you also mentioned to me. Not have too many words and not have it go too fast, right? But yeah. And intersectionality is something to consider of different immigration backgrounds, cultural, racial identities. Even if you're not an immigrant, still different aspects, different cultural. You can be Canadian and as well a mosaic of different cultures, at different stages of dementia. And like I originally said, there was interest from residents who previously did turn away from the videos. And thus we observed increased ADL assisted daily living behaviors, which was great because sometimes the care aides can't be there at everybody's side, specifically, or the nurses. We just can't be specifically there, always trying to help everybody drink water specifically. So conclusion and final takeaways is that the paper we set out to study, mainly what we set out to study was the effects of videos catered for people living with dementia, what effects it could have on how maybe perhaps helping improve with preventing responsive behaviors, perhaps against lack of attention, lack of staffing, to help act as something for the residents to also spend time with. that they could also understand easily, because the videos would be catered to them. But there is a lack of verbal feedback about these videos from the residents that this intervention was targeted towards. We did a lot of our data collecting based on observing behaviors, but sometimes, of course, with our target audience, it is hard to get that feedback. So we did rely a lot on the staff and on the family, which is very important and also equally valuable in data. But we were just lacking this verbal feedback from the residents. We only have 2 facilities that we are working with right now. I think we were thinking of adding another facility, another long-term care home, but adding these takes a lot of time and work. So we're working towards it in this research project. But right now we only have 2. One, which is a care home Villa Cafe, that is primarily for residents who are of the Chinese background, Cantonese speaking, and just a lack of expert perspectives in psychology and communication that might have helped. This lab is a lab in the School of Nursing at UBC. We do have students, a lot not in nursing, but it would have been nice perhaps to have more experts with different aspects to help widen our knowledge. And of course, final takeaways. I'm sure Lily can explain more on this about how important collaboration with patients and families are in research, especially if it's clinical research.
Yeah, it's important because the family member have firsthand experience with their family member who has dementia. So they kind of understand the process a little bit differently, what they put in for the caregiving, and what they think is appropriate in the video to include.
Yeah.
For instance, like to have an older face on the video means something for the resident because they can relate better with person with similar age, and
Yeah.
and they could maybe they could drink the water more willingly.
Yeah, exactly the point. So yeah, I don't know. And here we're constantly talking about patient-centered care. But sometimes as a nursing student, I was wondering, well, how am I going to implement this patient-centered care? And a lot of that I feel like would come from patient and family centered research that will eventually translate into care in the hospitals or in the long-term care homes or anywhere. And of course, the final most important takeaway is sometimes I think my wording maybe was sometimes iffy in the beginning, but it's that we should be asking ourselves how to adjust our interventions to be more inclusive than going, oh, these patients are not, taking our interventions. These patients are not using the patient education materials. It's something with our patient education materials. Why wasn't it more inclusive? Why would it only target certain groups of people, especially also with how diverse Canada is, which is our strength, but also taking in mind that when a lot of times when people do age or come across conditions like dementia, they do forget the second language that they do work really hard to learn. And as well, people bring their family here all the time. So it is something that we should be asking ourselves constantly. That would be, the most important takeaway. And in general, if you have more questions as well after the presentation, after this journal club meeting, in case if I can't answer them or Lily can't or we don't have time, this project was at the Idea Lab. You can Google Idea Lab TV study for just a web page. We make one for every project. And of course, the main writers of the paper was Karen and Dr. Lillian Han. But yeah, if you're interested, this is contact info. And you can easily find more information about our project. But I will just stop the screen sharing for now, so I can see people's faces. But I can pull up the screen again anytime.